Our 1 to 1:30 session is on the topic of PHSA PANDA and data governance, and I'm sure our speakers will be letting you know what PANDA stands for. Please join me in welcoming our two guest speakers, Michael Coss and Penelope Nica. Michael is the Director of Data Governance at PHSA, focusing on creating and implementing a new framework for data sharing, access, and use. He has worked in public health informatics for over 25 years, spanning chronic disease, health promotion, and communicable disease, focusing on ways that technology and information management can help improve health outcomes. Penelope Nica is the Director of Data Platform Architecture, Operations and Special Projects at PHSA, focusing on implementing the PHSA PANDA platform. She has worked in healthcare for over 25 years, most recently with PHSA's IMITS eHealth department to deliver COVID-19 digital solutions. For those of us in the audience who are not as familiar with all the acronyms, we'll look forward to hearing what these all stand for from our guest speakers. Over to you two. Welcome, Michael and Penelope.
Thank you for having us here today. I'm very happy to talk about PHSA PANDA, and Mike will talk about data governance, so you can learn what it is, and it's not just a furry animal. So here we go. So PANDA, what does it stand for? PANDA is the platform for analytics and data, and it's the new cloud-based solution delivering a comprehensive, integrated, patient population-centered data platform to meet PHSA's program, reporting, and analytic needs, from operational reporting through to research. So that's a lot. That's a big mouthful. Essentially, it is the platform for PHSA analytics. It is the result of a 2019-2020 strategy endorsed by the executive leadership team and the PHSA board to develop a roadmap to define and coordinate organizational data, integrity, governance models, and structures. So, data is important. It shouldn't be siloed in systems. It's longitudinal. So it's a patient journey from various systems. And how do we take that data to make informed decisions? So with COVID-19, it really expedited this need. And so in early 2020, a COVID POC was developed and built, combining 4 major data sets: BC CDC, Ministry of Health, Registry Information, and COVID data sets. And it's been successful, and it continues to be successful today. There are multiple COVID-19 initiatives actively using the COVID POC. So it demonstrated the value of the integrated data in a cloud platform. So that was early 2020, and it's a POC. So the next part was build the real thing, build PANDA. So I'll go over the timelines. So we do have PANDA up and running now, and it's a little bit separate from COVID POC, but we will be integrating them together. So the journey, where are we today? So as you can see, in early 2020, we had board approval and ELT approval. You see COVID happening throughout. And the big pieces are July. July is when we went live with our first lift and shift. So we have a EDW, which is our enterprise data warehouse. It was on premise, and so that's what many programs connected to do analytics. We moved that into the cloud, and so that was our big lift and shift in July. We are here, and we're just about to drop our second release, and this is where we're going to have something called PAUSE, and I'll tell you what that is later. That's where we're going to merge that COVID POC into our larger PANDA platform, and we're going to introduce some new statistical analysis tools. So what do we promise? There's 4 major areas that we focus on. One is data, making sure that we've got standards, we've got quality. To me, when I think about analytics, it's like going to a store. You don't go to a store and see wheat and sheep and cows. You need it baked. You need it in an analytic ready form. So we want to make sure there's quality control. We've got standards. We have to have an inventory for what's on hand. So that's the first one. Technology, behind the scenes. How do we transform the data? Where do we host the data? How do we architect the data? For the users, do they have the tools they need to do visualization or analytics? How do they share their dashboards and analytics with their end users? So I'll have a future slide to talk a little bit more about what we've got today. The next one is business strategy. How do you prioritize development and the data governance? So you need that. And the last one is human resources. You need people. So, you need people to work together, to raise the talent across the organization, to do analytics. You need people to support the platform and the services that PANDA will provide. So again, it's the power of PANDA. We grow as the organization evolves. We have data in what we call a central zone, so Ministry of Health data sets that are in there that we can link with program data from PHSA, so we can do and complete that longitudinal analysis. We have tools that we currently support today and will continue to build out. So in the analytic community, if there are tools that can do things better, faster, we'll integrate them into the platform. Services, we're looking at, instead of having little silos of analytics per program, this is the PHSA solution. So we can coordinate training across the organization. We can develop communities of practice. So an analytic person in one program doesn't need to be alone. They can go across to their peers across other PHSA programs. We can provide lunch and learns. And the last one is partnership. We partner with the Ministry of Health, research communities, PHSA programs and services. So it's working together to do analytics. So this is the quick overview of the tools. I won't go into it too much because I don't want to take up too much time. The PANDA release approach. So I did mention before, we have dropped release 1. We're about to drop release 2 this month. And then we've got future releases planned for the rest of the year as well in 2023. So where are we today and where are we going? What can you do in the PANDA platform today? So today, we have something called the PANDA portal. It's a SharePoint online site, and it's where you go for everything PANDA. You've got news about PANDA, you've got training links, you've got links to the subsites. The subsites are where programs can communicate to their users about their reports and dashboards. That's where you can go to request data, access. It's anything that you want to know about PANDA, it's there. Today, we also offer, I mentioned, program subsites. So it's a subsite on SharePoint online, and that is where they can show their reports and dashboards. It is secure, so not everyone can access it. And so we've put those layers in. In the future, we hope to have Microsoft team channels. So when I talked about collaboration across the organization, this is where we'd have a team channel for potentially a tool like Power BI. So if you have a problem, or if you have something cool, you can reach out to your analytic colleagues across the organization and have that discussion. It is coming soon because we are very dependent on the MS Teams rollout that we're very eager to see, so we can start to support that need. I also mentioned lunch and learns. So this is where we'll have tool lunch and learns, and we'll bring in guest speakers who know lots about a certain topic to really get people thinking and how they might want to build in the future. And again, we're going to have training. So a lot of sites are not yet on PANDA. So we'll have a training experience that's very geared towards helping that change management. So when they come on board, it's a seamless process. The analytic and reporting tools that we have, currently the platform supports Power BI and Microsoft Report Builder and SAS 9.4, but we are building out. So in December, we'll also provide SAS Via, which is like the latest and greatest way to use SAS. We're looking to also in the future deploy our Studio Server, ArcGIS, and Databricks as well. And that's a data management tool that can help, if you've got large swaths of data, how do you look at it and massage it more quickly in a more performant way? So PANDA also includes data, and this is where I'll hand it over to Mike and he'll talk about data governance.
Okay, thanks, Pen, and can everyone hear me? Excellent. So PANDA is, as part of the PHSA infrastructure and a major component of the PHSA analytics strategy, is also supported under our PHSA data governance approach. So one of the other pillars of the PHSA analytics strategy that Pen mentioned as being approved in 2020 was the establishment of a central data governance framework for PHSA. So we've been working over the last year and a half to define that framework and start implementing it. So the way we define PHSA governance is as an organization-wide approach to enhancing the use of data to support PHSA's mandate. And it defines a collection of structures, services, activities, et cetera, to support really all types of data use, from operations, clinical use, analysis, and research in a secure and safe way, but really is promoting the use of data while building trust and upholding our legal and privacy principles. So you'll notice that there's several words in this definition which really speak to how we're wanting to move the conversation of data governance from strictly from a privacy and protection lens to be how can data governance be an enabler for access and better use of data, both at PHSA and across the health system as a whole. Next slide, please. So we have a number of high-level goals. The first of which is to really move away from the traditional ownership concept or model for data governance, where every individual group is in full control over how that data is used, and to recognize that this really is the patient's data, and it's needed to support the health system as a whole. So we really want to move the organization more towards a stewardship model, to recognize that all of us play a part in stewarding the use of data for the benefit of our populations and our patients to improve the health system generally. So we all have a part to play, and we are stewards, not owners. Of course, while making sure that we're using the data appropriately and safely. We do still have laws and policies to comply with, but how do we do that within these restrictions? We really, as Penn mentioned, we want to really enable better collaboration across the programs, not just in terms of the tools and the data, but just in terms of how we steward the data as well. Better supporting research uses of data, and recognize that research is a core component of PHSA. And as we move to new models such as learning health systems, we need to be able to enable faster access to data for those purposes, and to improve the discoverability and understanding both of our data assets as well as what is being done with data across the organization. Next slide. So I won't go into details on this, but just to say that we have developed the overarching PHSA governance structure, which at the top you see the Chief Data Governance and Analytics Officer, that's Lexi Flatt, and she is essentially accountable for PHSA's governance program. We've established a number of committees to support various aspects of the governance model. And then in the programs, the program leadership, both their clinical and operational leadership, as well as their analytics leadership, then have responsibilities to meet the requirements of the framework and the standards, et cetera, that are being implemented. And those, like IMITS and others that have custody of the data, where they fit in relation to decision-making, et cetera, with respect to these data sets. And of course, all of that is supported by the data analytics reporting and evaluation team, which Penn and I are part of, research and academic services, IMITS, information access and privacy, and others. Next slide. So we are working on a number of standard practices now, and we have a number of them that are upcoming on our plate as well. So we are trying to harmonize the data request process across PHSA. Currently, it's quite siloed amongst all of the different programs. So we want to harmonize that and centralize the data request application for people seeking to use PHSA data. We want to, and we have now established a central data catalog for documenting our data sets and the metadata associated with them. We are working closely with the Ministry of Health and aligning with their Health Data Platform Initiative, and to make sure our processes and technologies are aligning with what they're doing at the provincial ministry levels. Working on how we classify data, and then the PANDA specific governance components, as you can imagine, with the PANDA releases coming out, have been a major part of our work recently as well, to establish the processes for requesting access to data, how we onboard new data sets, and how they get managed once they're in the common platform. And then there's a number of upcoming standards we'll be working on as well, all the way from what considerations need to be made when programs are considering implementing new data collection activities, all the way through to what happens with any analytical results and how those get vetted, and through to making sure that things are in compliance with policies around data retention and destruction, et cetera. Next slide. Little hard to read probably on the screen, but I think you will have copies. But the data catalog has been one of our big achievements over the last little bit, which is that metadata repository. So it's now available for programs to start documenting their data sets in, and we're working through our data standards and methods committee, which the analytics leadership across PHSA is part of, to begin developing the the standards around what goes in the data catalog. But it is really open for any groups that want to start using it, and just need to get in touch with us to get started. Just to start out with, we're starting to document those things in PANDA, but the expectation over time is that it will expand to include really any PHSA collected information across the organization. And it collects information about the data sets themselves. So what are what are the data governance requirements around that data set, and what are the data limitations and data quality issues, down to field level information, so that analysts can understand better what types of data they're accessing, and maybe if a particular data set is really adequate to meet their particular analytic needs. Next slide. So something that's maybe of particular interest to this group is governance around particularly these big shared clinical systems such as CST Cerner. So I'm sure I'm not saying anything new to anybody here, but CST Cerner is shared between VCH, PHSA, and Providence Healthcare. And the traditional approach to data governance would have meant that anytime anybody wanted to use Cerner data beyond direct patient care, they would have had to have gone to all three organizations to receive permission to use that data. So we have agreement at a high level to move instead to a model across the VPP where we will develop a set of criteria using something that's called the 5 Safes framework. 5 Safes is a way of assessing the risk basically associated with a particular data request. So we'll be establishing criteria under which individual health organizations can review their requests, and then if things are meeting those criteria, then it would only require that single health organization's governance process to approve that request with a simple notification to the other 2 organizations. And then if things then are not meeting those criteria, then we can have larger discussions across the 3 organizations on how to handle that particular request. So this is very much in line with the direction that ministry has been taking with the health data platform as well. So they are also using the 5 Safes model and basically creating a fast track for requests that meet those. So we're going to be implementing the same type of model across VPP, starting with CST, but our hope is that it will expand over time to include other shared systems as well, and potentially expand to include other health authorities that we at PHSA have partnerships with, and have shared systems where we have shared shared stewardship over data within those systems. So we're really hoping that this is a model that really enables and facilitates better access to people across the health organizations for things like quality improvement initiatives and program evaluation, as well as research. And we have been working with the CST governance structures as well, and to make sure that both the governance structures within the organizations, as well as the informatics structures within the organizations, are kind of aligned in how we're treating these data requests. So I will stop there and open up for any questions to either of us.
Thank you very much, Pen and Mike, for that wonderful presentation. To our audience, we do have time for some questions. Please feel free to unmute yourself or enter them directly into the chat box. And I see we have one from Shar. It will be useful to have a centralized data governance process. What will be the full scope of types of data that can be requested?
It's a good question. So the hope is that eventually any data sets at PHSA that have been collected, except potentially those that are collected under research grants. So the goal is over time, yeah, pretty much all of the registries, the clinical information systems, you know, any of the really any of the operational systems across PHSA. We will also have integrated things like HR and financial data. Of course, those will have you know, their own set of restrictions associated with those, as will many of the data sets, but they will all be folded under the same overarching approval process. And I will say too that we have now established a single information sharing agreement with the Ministry of Health. And so Ministry of Health data sets are also going to be available through PANDA under our governance as well, without having to set up separate information sharing agreements with Ministry for every separate initiative. So.
Thank you for answering that. And I think there is a follow-up from Shar. How can we help transition practices from being siloed to transitioning to diverting all data requests to PANDA?
It's a very good question. So we do have the committees that we have established, and so all the programs are represented in the various committees. We are establishing the standards, and we'll be developing some policies as well to support those. We have, for example, for the data access or for the data request process, we established a working group that has been informing us on what types of criteria and things that need to be in part of the process itself to make sure we're accommodating the needs of the programs there. And then I think as PANDA builds up, and Pen may want to add to this, but there is, I think, from the executive leadership team, an expectation that programs will be moving their analytics over to PANDA as we get their registries and other data sets integrated into PANDA. So there is a general agreement, I guess, or endorsement at the ELT level that the organization will not invest in separate analytics solutions at PHSA, that they will, those will be funneled through PANDA as it continues to be built out. I don't know, Pen, if there's anything you wanted to add to that.
Nope, that was good.
Okay.
We have time for one more question. Anything from our audience?
maybe I'll just put a plug in to say, on the PANDA portal, check out what's there. We haven't published much yet of the data governance work, but we are hopefully going to be publishing more of that soon. So keep an eye out for that. And then I know that there's a PANDA PHSA mailbox. If you have suggestions or questions around PANDA, and then we have a data governance at PHSA mailbox. If you have any suggestions or questions about our data governance activities.
I have a question for Pen and Mike. So I believe, so in this presentation, when I learned about PANDA, I can easily say there are many people out there who are much smarter than me, who knows a lot more about data analytics, especially for people who use data analytics on their everyday work. So for somebody who works at PHSA across the healthcare system who may not need to use data analytics every day as part of their job, what is the best way to engage them and letting them know that this impacts them as well? As we all know, as we go more digital, it's inevitable that data is a big part of us forming and delivering quality healthcare.
So the question is how to get engaged with PANDA? Is that right?
Or yeah, or even what would you say to somebody who is not as familiar with data analytics, that this has an implication on their work and their role in the healthcare system too, that they should care?
I would strongly encourage them to reach out and go to the PANDA portal and see what there is to offer. And I think the training path in there as well would be also very useful. So if you don't know where to start, don't know what tool you use, you can always reach out to PANDA at phsa.ca and ask that question, or look at the tools that we have on the portal, because we'll recommend, if you don't know anything about it, here are some beginner courses to get you started. And this is how you can request access to that tool. And once you sort of gain that knowledge, then we'll have those lunch and learns for intermediate to advanced users to help you continue to grow with that tool. Or here's the best practices, or here are some tips and tricks to use.
And I'll just add to that as well. Under our new governance framework, we have established a new role at the program level called the Program Analytics Leader. And so we've established the responsibilities for the program leaders, and part of those responsibilities is further communication across their programs around what's happening. And then we do plan to provide training for those analytics leaders as well, and provide tools and products and things that hopefully can help them to engage with staff within their individual programs. And then the PANDA portal will have a training section to then help guide people down whatever pathway is appropriate for them.
Thank you so much. That was fascinating. I will definitely take advantage of the PANDA portal and all the resources that it offers.
I do see there's one more question around patients and communities. I will say they're not directly represented yet. We've been really just trying to establish at this point what the frameworks are and what things we need to focus on, but we have definitely identified that is that it is something we need to include. So it is in the kind of the plan to figure that out. And then from a community standpoint, we are trying to look now at how we define communities that are ones of particular, that may have particular impacts to from our analytics efforts. And so how we start looking at engaging them and making sure that what we're doing and what PHSA is producing from a data standpoint is safe from the perspective of those communities. So we are having those conversations, and yeah, it's still evolving now.
Well, thank you once again to our two guest speakers, Pen and Mike. We are so grateful for your time and to present your presentation of PHSA, PANDA, and data governance to our audience. Thank you.
Thanks.
Thank you.